The oral cavity receives innervation from the fifth cranial nerve, the trigeminal. A smaller part of this nerve is motor, while the larger part is sensory. The sensory portion forms a large half-moon-shaped ganglion called the trigeminal, semilunar, or Gasserian ganglion, which is situated in the trigeminal depression of the middle cranial fossa. Originating from the trigeminal ganglion are three large nerve trunks: the ophthalmic, V1, the maxillary, V2, and the mandibular, V3, the last of which is the largest and the only one that carries both sensory and motor nerve fibers. The mandibular nerve passes through the foramen ovale down into the infratemporal fossa, where it separates into a small anterior and a large posterior root. The anterior root gives off motor branches that innervate the muscles of mastication. Then, as the buccal nerve, it crosses the coronoid notch of the ramus to innervate the cheek. Small fibers pass through the buccinator muscle to supply the buccal gingiva and mucosa in the posterior mandible. The posterior root of the mandibular nerve is predominantly sensory, although it does provide motor innervation to the mylohyoid muscle and the anterior belly of the digastric. As it descends, it divides into three branches. The auriculotemporal nerve supplies the skin of the temporal region of the head. The lingual nerve provides general sensation for all of the lingual gingiva and the mucosa of the floor of the mouth and anterior two-thirds of the tongue. In combination with a branch of the facial nerve, the chorda tympani, the lingual nerve also carries parasympathetic innervation to the submaxillary and sublingual glands and taste fibers to the tongue. The third branch of the posterior root of the mandibular nerve, the inferior alveolar nerve, passes through the mandibular foramen to enter the mandibular canal. Running forward in the canal, this nerve gives off branches to the teeth of the lower jaw and the surrounding alveolar bone. The mylohyoid nerve branches off just before the inferior alveolar nerve enters the mandible. It provides motor function to the mylohyoid muscle and the anterior belly of the digastric muscle. Also, it often innervates the skin covering the lower chin and occasionally provides sensation to the mandibular teeth. The mental nerve emerges as a lateral branch to the inferior alveolar nerve and passes through the mental foramen to innervate the anterior buccal gingiva and the lower lip and chin.
All the various intraoral injection techniques have one thing in common. The target site for assessing the inferior alveolar nerve lies within the pterygomandibular space. Detailed knowledge of the pterygomandibular space and the relationship of both its neural and vascular components will help the dentist perfect mandibular anesthesia.
The pterygomandibular space, as seen in this transverse section across the ramus of the mandible, is bounded medially by the medial pterygoid muscle, laterally by the mandibular ramus, posteriorly by the parotid gland, and anteriorly by the oral mucosa, submucosal connective tissue, and buccinator muscle. Superiorly, it is defined by the lateral pterygoid muscle. Within the pterygomandibular space are the inferior alveolar and lingual nerves, the inferior alveolar artery and vein, and the sphenomandibular ligament. The inferior alveolar and lingual nerves enter the pterygomandibular space by passing between the medial and lateral pterygoid muscles. The lingual nerve follows a downward and lateral course through the space until it reaches the most anterior and inferior corner, where it exits into the floor of the mouth. The inferior alveolar nerve passes through the pterygomandibular space, lateral and downward, behind the lingual nerve, assuming a slight S-shaped configuration until it reaches the mandibular foramen.